Hi, I'm Dr. Russ. Today we are going to look at Evelyn's neck and shoulder problem, which has been bothering her for a long time. She calls it a forever problem. She has pain in the right upper trapezius, levator area, comes out the supraspinatus a little bit. It's been there a really long time, and what I'm feeling is a lot of tightness in her right upper trap and levator and the rhomboid. And it's got her scapula a little bit frozen to her rib cage. And we've gone through and we've done some testing of muscles, and the strength is pretty good and the stability is pretty good, so we're not too concerned about the safety of the shoulder. But one thing I did notice was a little bit of a difference in neck extensor strength. So if we test her extensors here, straight back, Evelyn, push your head straight back against my hand, we have a nice response. If we test the left side, push back here, we get a nice response. If we test the right side, push back here, and it's a little bit weak there. So when there's an imbalance of the neck extensors, let's say, like in her case, the right is weak, not only does the left get tight, but the other neck extensors will tighten down in order to compensate for that weak right extensor. Now in chiropractic, we see a very common correlation between a weak neck extensor and a problem with the sacrum on the same side. So we're going to turn Evelyn around and have a look at her sacrum and see how it's moving. To examine the sacrum and its mobility, the really important movements are rotation and side bending. So if I have a finger on her PSIS and a finger on her sacral base and rotate her toward me, I should feel that joint slide back a little bit. Same thing on the other side. And that's actually pretty good movement. There's only a couple millimeters of movement there. Now I'm going to take my fingers on the apex of the sacrum and bend her each way. And what I'm feeling for is a lifting of the sacrum on the side that she's bending to. On the left I feel a good lift, and on the right I don't feel a lift. So we're going to work on this as well as this. And we'll start with you facing down. You can see the difference from left to right of the way her scapula move, and that left scapula, as I slide up, responds pretty nicely, moves up, and then as I take my hand away, it just sort of springs back. On the right side, I'm actually starting to get some resistance all the way down here around the 6th rib, and there's a lot of resistance here in the lower trap. We can see some fibers in here that are twitchy and tight. So really this neck problem does extend down into the middle thoracic spine, as they often do. So we're going to look for some improved mobility of the scapula and some more mobility of the soft tissues in here. So as I'm feeling her right sacroiliac joint, I'm definitely getting a lot of tension coming into this joint from the side. So we're going to start on the side and follow those muscles as they come in and hook into the SI joint from the outside. See if we can get some more motion in there. With my left hand, I'm on her sacral base, and with her right hand, I'm pulling her hip bone toward me. And we're starting to get a little movement there. You okay, Evelyn?
Yes.
Is that ticklish? Yep. Good. Just maybe 3 more, okay? Good. 1 more. Perfect. You see a lot of trigger points in the upper gluteal, and there's one right there. My finger's kind of sliding over it. So we're going to gently elongate those fibers. Remember that muscles are healthy when they're mobile and when they have good circulation. So most soft tissue work really should be about circulation and mobility. That's perfect. Now to finish this here, I'm going to do something called an induction, where we take the movement that's not quite happening right. Remember on this side on the right, it's not coming up very well. And we're just going to really gently induce that movement with our hands. The patient is passive. And then we follow the movement as it works its way through. In her case, her sacrum wants to come to the left in order to allow it to move up on the right. And we're just going to let it do that until it gets more movement coming up on the right. Now we're ready to do more shoulder work. And when you're working with an upper trap, you got to remember that it comes all the way out to the AC joint, attaches to the clavicle in front. You find a lot of problems and trigger points there. So right now I'm kind of scooping my thumb along the lateral part of the clavicle, the collarbone, looking for trigger points there. And don't forget about all the fascia between the skin and the muscles too. That stuff has to be moving as well. Now coming a little deeper to the rhomboid, right here from her lower cervical spine out to the scapula, really pretty tight. So I know that's what's giving her a lot of symptoms, but I don't think it's really the cause of the problem. I think the cause of the problem is probably more in the sacrum. It doesn't feel very scarred in here. There's not a lot of fibrosis. There's not a lot of scar tissue, which is nice. That makes it easier. I know Evelyn's done a lot of work on her movement in the past few years, and I think she's probably come a long way. Maybe just needs a little bit of help here. Good. You might be tempted, if you were feeling this, to adjust some of these ribs here, because they do feel kind of prominent and rigid, but I wouldn't want to try that until I felt this lower trapezius was more relaxed. Coming up the side of her neck now, feeling the levator scapula, and it's pretty restricted right here around C5. So let's do another one of those inductions here. And with the hands, induce the movement that you're trying to get into the spine, and then follow it. Gentle. The fascia of these neck extensors attaches to the base of the skull and comes up around the ear. So we're going to follow that line all the way up and around and loosen it up. And now we'll ask Evelyn to turn over and we can look at her neck a little more. Okay. So I'm going to come through, I'm starting here at about T3. I'm going to feel each vertebra one by one and see if anything is in need of adjustment. Something is. Feels like the lower cervical spine, so let's kind of zero in on that. Yeah, you feel this here.
Mm-hmm.
When was the last time this was adjusted?
September, maybe?
Okay, a couple months then. Okay, so it's rotated to the front on the right. So I'm going to get a hold of it on the right with my right thumb, on the left with my left thumb, and we're going to turn it this way. Just like that. Okay. You okay there?
Mm-hmm.
Good. No movement. So let's try it a little bit of a different approach. Still trying to rotate the same way, but different contacts here. There it goes. Nice one deep resonant sound rather than a whole which I prefer. We get one nice sound. Thanks, Evelyn.
Thank you.
Appreciate it.